cyanotic congenital heart disease and cyanotic congenital heart disease. So now how do we remember the most common causes of acyanotic congenital heart disease? The acyanotic is start with A. So here we will look for A, like this A. For acyanotic, this A is for arterial septal defect. It is started with A. Now invert this A, it will become V. So ventricular septal defect. Or if we just know the arterial septal defect is acyanotic, the ventricular septal defect is also an acyanotic. Patent ductus arteriosus, so A is also here. If you see here in arterial septal defect, A and D is here. In ventricular septal defect, D is here, and we invert this A, so it become V. And in patent ductus arteriosus, D and A is also here, and coarctation of aorta. Now, which one of the following is the most common or very common acyanotic congenital heart disease? That is ventricular septal defect. So how do we remember? If you just see very common, so very start with E, V, so this V is for ventricular septal defect. Which of the following is the most common acyanotic congenital heart disease? We show it in the adult. So in adult, A start with A. This A is for arterial septal defect. Now, which of the following is acyanotic congenital heart disease most common in premature baby? The premature baby start with P, that is patent ductus arteriosus. Now, for the cyanotic congenital heart disease, the very famous mnemonic, that is 4T. So these will be started with T. Tetralogy of Fallot, transposition of great vessel, tricuspid atresia, total anomaly, pulmonary venous connection. So all these are started with T. But here we have to keep in mind another most important point, that overall, which one of the following is the most common cyanotic congenital heart disease? That is tetralogy of Fallot. But at birth or up to 1 to 2 months, that is transposition of great vessel. So we have to keep in mind this time. At the birth, that is transposition of great vessels. A 2-day-old baby girl is noted to become cyanotic while feeding and crying. A diagnosis of congenital heart disease is suspected. What is the most likely cause? First of all, we have to understand is it is a cyanotic or acyanotic. Here they are saying cyanotic. So it is a cyanotic congenital heart disease. The cyanotic congenital heart disease will be started with T. So we will look here for the T. So you can see transposition is also started with T, and tetralogy of Fallot is started with T. But in between these two, the time, the age of duration we know. Like for the transposition of great vessels at the birth or up to 1 month, that is transposition of great vessels. Overall, the cyanotic congenital heart disease, which is common, that is tetralogy of Fallot. But in the newborn, that is transposition of great vessel. The answer here will be A. Here the correct answer is A.